Hi, my name is Greg Fell, I'm Director of Public Health. This is a situation report of 6th of September. So epidemiology firstly, largely unchanged from last week. 7-day case rate still in the order of 300, 350 per 100,000. And remember, this time last year, it was in the order of 20 to 40 per 100,000. So a huge difference. Very high case rate. Principally younger adults, and the rate is increasing in younger adults. Some levelling off in older adults, which is welcome and to be pleased about. This will flip. We've got a very high baseline. Schools, universities are beginning to reopen. Schools are already open, obviously. That will flip. There's no doubt about the fact that will flip. It will flip very quickly and will start to go up again in the not too distant future. My estimate is by this time next week, I think. We're seeing a steady rise in the numbers of people hospitalised, and particularly the numbers of people hospitalised needing oxygen support. Principally in the 15 to 55 age group, principally unvaccinated 15 to 55-year-olds. There are still plenty of unvaccinated adults out there. The Delta variant will find them. So message, get vaccinated if you haven't already been so. So case rate is high. There is harm out there. There are 1 or 2 deaths, not many. Harm is not as high as the case rate may suggest, and that's principally on account of the vaccination programme, which brings me on to vaccination. Currently, about 73% of adults are fully vaccinated, i.e. had second dose. The second dose really matters. So if you've had dose 1 but not yet dose 2, please do so ASAP. So 73% is an amazing effort, but that is a population average and belies that there are some disparities across the city, and we're working hard to reduce those inequalities in vaccination coverage. But there are some groups where vaccination coverage is much lower. And even if you take 73%, that's still 27% of adults that aren't fully vaccinated. I'll come back to the Delta variant is out there in very high case rate, and it is harming people still. So if you haven't been vaccinated, it's really worth your while. People have emailed me, they're concerned about the side effects of the vaccination. All I can say is the medical evidence is overwhelming. The benefits of vaccination hugely outweigh the side effects. There are side effects. There are side effects with any vaccination, and this is no different. And all of those side effects that people are concerned about are also present if you're infected. So the best way to reduce the what would be the side effect of vaccination is to actually get vaccinated, because vaccination reduces your chance of being infected. So the control measures are pretty much as they were. Almost no restrictions on mixing. Now we're well past step 4 of the roadmap now, so no restrictions on mixing. The control measures are test if you've got symptoms, regular testing for those who are going outside the house regularly with lateral flow device testing, contact tracing if you are a case, and isolation is the most important thing. If you have symptoms, stay at home. Vaccination obviously is important, I've talked about that. Ventilation, simply opening the windows makes a difference. It gets fresh air circulating in the house or the building that you're in. Hand washing and face covering. I still wear my face covering pretty regularly on all enclosed public spaces, aka public transport. In summary, we've got a high case rate. We've got a relatively low rate of hospitalisation, but not trivial. We're going to have a high case rate for some time, and that is going to go up into the autumn and into the winter. We're going to then combine that with flu. It's important that if you're eligible, you get your flu jab as soon as possible. So we're going to have a difficult autumn and winter ahead of us, and it's important that you protect yourselves and others for the foreseeable future.